Hello, my friends. I'm Dr. Linda Parker, your guide in kidney health and healthy aging. And today, I want to talk with you about something that almost never appears in TV commercials or glossy brochures. The safe medications that can quietly damage your kidneys after 65. For years, many of us were told that if a pill is approved, common, and sold everywhere, then it must be harmless. But your kidneys live in the real world, not in advertisements. They feel every pill you swallow, every combination you take, and every year that passes. My goal in this video is simple: to help you understand which medications deserve more respect, how they strain your kidneys in the second half of life, and what you can discuss with your healthcare team to protect your long-term independence and vitality. Before we look at specific drugs, let's remember what your kidneys actually do. Each kidney is full of tiny filters that clean your blood all day, every day. They remove waste, balance fluids, control minerals like sodium and potassium, help regulate blood pressure, and support healthy bones and red blood cell production. As we age, those filters naturally lose some efficiency. That does not mean you are doomed, but it does mean you have less reserve. A 30-year-old kidney can bounce back from stress more easily than a 75-year-old kidney. At the same time, the older we get, the more medications we tend to collect. Pills for pain, blood pressure, heartburn, sleep, mood, infections, and more. Each one passes through the kidneys in some way. One pill might be safe, but 3 similar ones together, or years of daily use with no review, can quietly erode kidney function. The first group of safe medications I want to discuss is probably sitting in almost every kitchen and bathroom cabinet: common over-the-counter pain relievers called NSAIDs. This family includes ibuprofen, naproxen, and several others used for headaches, back pain, tooth pain, minor injuries, and especially arthritis. Many people over 65 live with chronic joint discomfort, and it's completely understandable to reach for something that promises relief in a small tablet. For a younger, otherwise healthy person using these occasionally, they can be reasonable. But in older adults, especially those with high blood pressure, diabetes, heart problems, or already reduced kidney function, regular NSAID use can be toxic to the kidneys. These drugs change the way blood flows into the tiny filters inside your kidneys. They reduce certain protective chemicals that normally keep those blood vessels open and flexible. When that blood flow drops, the filters are starved of oxygen and nutrients. Over weeks, months, or years, the damage can add up to permanent loss of function. The dangerous part is that you often feel nothing unusual. You may notice less pain, so the medication seems helpful, while your kidneys quietly struggle in the background. Imagine a 70-year-old woman with knee arthritis. Her doctor once mentioned that ibuprofen helps, and now she takes it 3 times a day because it's over the counter. She also has slightly high blood pressure and is on a water pill. No one has ever sat down with her to explain how age, blood pressure medication, mild dehydration, and NSAIDs together can form a perfect storm for her kidneys. She doesn't see any warning label flashing red every time she opens the bottle, so she assumes it must be safe. Then, a hot summer arrives. She eats less, drinks less, but continues the same pain pills. Her next routine blood test suddenly shows that her kidney numbers have worsened. To her, it feels like it happened overnight. In reality, the foundation for that crisis was being built one harmless tablet at a time. This is not about blaming patients or banning NSAIDs forever. It is about using them thoughtfully at the lowest effective dose for the shortest time possible, and always letting your doctor know exactly how often you take them. The second group of medications often treated as harmless is long-term acid-suppressing drugs, especially proton pump inhibitors, commonly used for heartburn and reflux. These are the pills many people take before meals or in the morning to prevent burning in the chest or throat. They work by drastically reducing the amount of acid your stomach produces. In the short term, this can be helpful for healing ulcers or controlling severe reflux. The problem begins when a short-term solution becomes a permanent habit. It's very common for someone to start one of these medications during a hospital stay to protect the stomach, and then continue it for years without anyone re-evaluating the need. Over time, these drugs can, in a subset of people, trigger inflammation in the kidney tissue. The immune system may react in a way that irritates and injures the delicate filter structures. Because this process is usually silent, there may be no obvious warning signs, no burning pain, no dramatic swelling, just a slow drift downward in kidney performance. Picture a man in his late 60s who started an acid-blocking pill years ago after a stress-related ulcer. He made healthier changes, smaller meals, less late-night eating, less alcohol, more vegetables. His reflux is now mild, but the pill remains. Every automatic refill says, continued. No one has asked if his stomach still needs that level of suppression. Meanwhile, his kidney function, once normal, shows a gradual decline on routine labs. There are many reasons this can happen with age, but his medication list never becomes part of the conversation. A more careful review might reveal that his dose could be reduced, or that he could transition to a milder medication or targeted lifestyle changes instead of long-term, heavy acid suppression. The key lesson is not that these drugs are bad, but that they should be reassessed regularly, especially after 65, with your kidneys in mind. The third group includes diuretics, often called water pills. These medications are used for swelling in the legs, fluid in the lungs, high blood pressure, and heart failure. They help the body excrete excess salt and water through the urine, which can relieve breathlessness, reduce ankle swelling, and lower blood pressure. Used correctly, they can be life-saving and kidney protective by controlling fluid overload. However, in older adults, especially those who are frail or have multiple conditions, the margin between helpful and harmful becomes narrower. If the dose is too high, or if fluid intake is too low, diuretics can leave the body too dry. When there is not enough circulating volume, the kidneys receive less blood. The filters cannot work properly, and waste products build up in the blood. The kidneys also depend on a delicate balance of minerals, like sodium and potassium. Overuse of diuretics can disrupt this balance, worsening kidney stress and triggering symptoms such as weakness, cramps, confusion, or dangerously abnormal heart rhythms. Consider an 82-year-old man with a history of heart failure. His cardiologist prescribed a water pill to control swelling, and at first it helped a lot. He was told to monitor his weight and watch for ankle changes, but as time went on, no one adjusted the dose. A spell of diarrhea from a stomach bug leaves him less hydrated. He remains on the same diuretic schedule because he does not want his legs to swell again. Slowly, he becomes dizzy on standing, more tired, and less hungry. A family member finally takes him to the clinic, where blood tests show acute kidney injury. The solution was not to abandon diuretics altogether, but to tailor them more precisely, give clear sick day instructions about when to hold the pill, and check kidney function regularly. The lesson here is that powerful drugs like diuretics must always be matched to your current condition, not just your past diagnosis. Asking, "Is this still the right dose for me, given my age and my kidney numbers?" is an act of self-protection, not defiance. The fourth group is less about a single pill and more about a high-risk combination that many older adults end up taking without knowing the potential consequences. This is the mix of a blood pressure drug that works on the renin-angiotensin system, often an ACE inhibitor or an ARB, plus a diuretic, plus an NSAID pain reliever. Each of these can be useful on its own. ACE inhibitors and ARBs can protect the kidneys and the heart when used appropriately. Diuretics help manage blood pressure and fluid. NSAIDs ease pain. But together, especially in someone over 65 with existing kidney vulnerability, this trio can dramatically reduce kidney blood flow. The blood pressure drug relaxes certain vessels, leaving the kidney filters. The NSAID constricts vessels, bringing blood into the filters. The diuretic reduces total blood volume. Your kidneys are caught in the middle, starved of both pressure and flow. Many people fall into this combination gradually. A primary doctor prescribes an ACE inhibitor for high blood pressure in the 50s. Years later, when mild swelling appears, a diuretic is added. Then in the 60s or 70s, joint pain worsens and an orthopedic doctor suggests daily naproxen for arthritis. At no point is anyone intentionally trying to harm the kidneys. Each specialist is focused on a particular problem, but none of them may be looking at the entire medication stack through the eyes of the kidneys. You, as the person living with these medications, have an important role here. Keeping a complete list and asking, do any of my drugs interact in a way that makes kidney injury more likely? Can open a crucial discussion. Sometimes the solution is as simple as limiting NSAIDs, adjusting doses, or choosing different pain strategies. The kidneys often respond positively when we remove even one piece of this burden. The fifth group includes medications and substances that many patients never even think to question, because they are usually given in hospitals, imaging centers, or during treatment for serious illness. I'm talking about iodinated contrast dyes used for some CT scans and X-ray procedures, and certain strong antibiotics that are filtered or concentrated by the kidneys. In emergency situations or when diagnosing potentially life-threatening conditions, these tools are absolutely valuable. They help doctors see blocked arteries, internal bleeding, infections, and tumors. However, for older adults with reduced kidney function, diabetes, or heart disease, exposure to these agents can sometimes trigger a sudden decline in kidney performance. The contrast material increases the workload on the kidneys and can temporarily reduce blood flow within the kidney tissue. Some antibiotics can irritate or inflame the delicate structures in the kidneys as they are processed and excreted. This does not mean you should refuse every scan or antibiotic out of fear. It does mean that you deserve a conversation about risk and protection. Before having a contrast-enhanced scan, you can ask, how are my kidney numbers right now? Is there another imaging method that might work? If we go ahead, what will you do to minimize risk, such as adjusting the dose or giving extra fluids? When an antibiotic is prescribed, especially if it is known to be hard on the kidneys, you can ask, is there a kidney-friendlier option that would still treat this infection effectively? Does my dose need adjustment because of my age and kidney function? These questions encourage your healthcare team to individualize treatment rather than using a one-size-fits-all approach. Now that we have walked through these 5 categories, common pain relievers, long-term acid-suppressing drugs, diuretics, high-risk drug combinations, and contrast or antibiotic exposures, what can you actually do to protect your kidneys after 65 without feeling overwhelmed or fearful? The first step is clarity. Gather all of your medications in one place: prescription bottles, over-the-counter pills, vitamins, herbal products, and as-needed remedies like pain relievers or sleep aids. Write everything down: name, dose, and how often you take it. Many people discover duplicates, outdated prescriptions, or pills they no longer remember the reason for. This simple list is your roadmap. Bring it with you to every appointment, and do not assume your doctor already has an accurate version. Electronic records are helpful, but can be incomplete or outdated. The second step is a medication review with a kidney lens. At your next appointment, choose 1 or 2 of your regular providers and say something like, "Now that I'm over 65, I want to protect my kidneys for the long term. Can we go through my list and identify anything that might be risky for my kidney health? Make it a shared project, not a confrontation. Ask 3 key questions for each long-term medication. Do I still truly need this? Is this the safest choice for my kidneys, given my age and my other conditions? How often should we be checking my kidney function while I am on this? Sometimes the answer will be, yes, you absolutely need this drug. The benefits are greater than the risks. That is valuable to know. Other times you may find medications that can be reduced, switched, or discontinued entirely under supervision. The third step is having a plan for times of illness or dehydration. Your kidneys are especially vulnerable when you lose fluids through vomiting, diarrhea, fever, or heavy sweating, or when you are not eating and drinking normally. Some medications that are usually safe at stable times can become dangerous in these situations, especially nonsteroidal anti-inflammatory drugs, certain blood pressure drugs, and diuretics. Many clinics provide sick day guidelines that explain which medications to hold temporarily and when to restart them. If you are over 65 and on multiple long-term medications, ask your healthcare team to help you create a clear written plan. Keep it in a place you and your family can easily find. That way, in the middle of a stomach bug or a heat wave, you are not trying to remember complicated instructions. The fourth step is supporting your kidneys with everyday habits that reduce their workload. You do not need a perfect diet or an extreme routine. Simple, consistent choices matter more. Drink enough fluids throughout the day so your urine is generally pale yellow unless you have been given specific fluid restrictions. Avoid heavy salt intake from processed foods and restaurant meals because excess salt raises blood pressure and forces the kidneys to work harder to excrete it. Keep blood pressure and blood sugar within the targets your doctor has recommended. These 2 factors are among the most powerful influences on kidney health. Engage in gentle physical activity most days of the week. Even a daily walk helps improve circulation and energy. Do not smoke, and if you do, seek support to quit. Each of these habits may look small on its own, but together they create a more forgiving environment for your kidneys. Let me share one more story that captures the power of awareness. A 74-year-old woman came to clinic believing that her kidneys were just failing with age. She was on a water pill, an ACE inhibitor, a heavy-duty acid-blocking medication, and 2 different over-the-counter pain relievers that she alternated for her back pain. She had never shown all of these to one doctor at the same time. Once we laid everything out, we realized that several of her medications were overlapping in their effects on kidney blood flow. With careful coordination among her doctors, we simplified her pain management, stepped down her acid-suppressing drug, adjusted her diuretic dose, and created sick day rules. We also encouraged daily walking and modest salt reduction. 6 months later, her kidney numbers were more stable, and she felt more in control of her health. The aging process had not stopped, but the attack on her kidneys had slowed. As we come to a close, I want to leave you with one clear, powerful idea. After 65, the most dangerous medications for your kidneys are often the ones nobody questions anymore. They are the pills that were started long ago, never reviewed, and quietly stacked on top of each other. You do not have to become an expert in pharmacology to change this. You simply have to become an expert in asking good questions about your own body and your own prescriptions. And here is the hopeful message I want you to carry with you. It is rarely too late to help your kidneys. Even if your lab numbers are not perfect, even if you have been on some of these medications for years, changes made now can slow further damage, lower the risk of sudden kidney crises, and give you more years of energy, clarity, and independence. Your kidneys have been working faithfully for you since before you were born. They deserve a little protection in return. If this conversation has been helpful, I invite you to take one small action today. Write down your full medication list and circle any pain relievers, acid blockers, water pills, blood pressure drugs, and recent imaging or antibiotics. Then, at your next appointment, bring that list and say, I want to make sure all of this is as safe as possible for my kidneys. If you care for an older parent or partner, gently encourage them to do the same. And if you'd like more guidance on protecting your health in the second half of life, consider subscribing, sharing this video with someone you love, or leaving a comment about your own experiences with medications and kidney health. I'm Dr. Linda Parker, and it's been an honor to walk through this with you today.